Hi, Jeremy, the tall trainer here, and I want to talk to you a little bit about foam rolling. And so it's kind of a weird thing. Sometimes people call it the pillar of pain, and so you'll see them like this. Sometimes they're longer than this. It can be bought at a lot of sporting goods stores, and what we found is it can be really helpful for relieving joint pain. Actually, really, it's kind of giving yourself your own deep tissue massage. And so there's a lot of people that I've done this technique with, and people have even limped in here. We've done some foam roll, and they walk out feeling really good. And so it's kind of a weird, magical kind of thing. And I want to show you a few techniques that you can do with the foam roll and why it's helpful. So again, it's a deep tissue massage that you're going to get. And one of the areas that can get really tight is our IT band. So it's right down the side of the outside of the leg there. And when that gets tight, it can cause pain in the knees. It can also cause some pain in the hips. It can cause lower back pain too. So it can all relate to that. So if you have one of those, that's usually one of the first things I try with somebody. So if somebody says, hey, I have knee pain, hip pain, or lower back, that's one of the first things we go for. Because if we can make it feel better with just a little rolling on some foam, how much better is that than going through a whole lot of extensive therapies or maybe even surgery on something that maybe doesn't need that much intervention. So start there, and it's not going to cause a whole lot of damage, but it might cause huge benefits. So what you're going to do for the IT band is you're going to start just below your hip joint on the outside of the leg there. You're going to have your elbow down on the ground. The other hand can be on the ground too. This other leg is bent up forward. And you're trying to bend this leg slightly. This one that's on the ground there. It's a slight bend in it because we don't want to be flexing. If we're flexing the muscle, it's not going to massage very well. So if you went to a massage therapist, they were working on your neck or something, and you were like tensing up the whole time, they would tell you to relax because they can't really massage a muscle that's being tightened. So you got to try to relax this bottom leg, and you're going to use your other limbs to kind of roll yourself forward, keeping your body weight on there. So your body weight is creating this tension. So the pain you're going to feel is the pain of that pushing into you. All right, so you're going to feel that. So a lot of times it's slightly towards the front. So people sometimes lay back and think, I don't really feel much. Sometimes shift slightly towards the front, and you may feel more. If you're not feeling much there, you can try lower. You adjust to different spots. But the way to make this level harder is you can double the legs up. So now you got a little more pressure pushing down. So if you have really strong legs or really tight legs, you might need extra pressure in order to get into that muscle. The other way to do it is you can bend the knees. So you can bend the knees, and that can get in there a little bit more also. So again, it's just getting that a little more access to that area, putting a little bit more stretch into that area. And so what you're going to do is spend about 20 seconds or so in each spot. So we're not going to just roll right past it. We want to actually see if we can get that to release. So we're pausing at a spot. So when you find a really tender spot, you pause there. The initial reaction of a muscle is to actually tighten up under stress. What we want to do is we want to stay there long enough so the muscle can release a little bit. So again, just like a knot in your back, if there's a knot, you kind of push, the massagers might push into there, and it hurts, and then all of a sudden it releases. And it's kind of like that here. Now, you're still going to feel some pressure even when it releases. You're not going to feel like it's gone. But I usually tell people it goes from being like you're being stabbed with a fork to being stabbed with a spoon. So it's not quite as sharp of a pain anymore. Okay, kind of gets a little bit more of a dull pressure of that foam roll. So you're going to work your way down, and you're going to stop before you hit the knee joint. And you can just set the hip down there, and you'll do both sides on that. And sometimes if you have a knee issue, you might come up from that and be like, ooh, that feels really good. But I'm going to show you a couple other ones that can help some other issues as well. I use the IT band one actually for my lower back quite a bit. So when I do the IT band, a lot of times my lower back feels better because I tend to tighten up in here quite a bit. Another one I really like is the calf. And so you cross the leg over. Make sure you relax the bottom foot, kind of a floppy, relaxed foot there. And you're going to you can lift up a little bit or just shift yourself forward, and you're rolling on the calf muscle. So make sure, again, that foot needs to be relaxed so you can actually get into that muscle. If that foot's tight, that muscle's flexing, you're not going to stretch it out at all. So you got to relax that. Sometimes it's a little more towards the outside edge of the calf or towards the inside edge of the calf. I think there's probably more people towards the outside edge, but for me, I think I got a little more towards the inside edge as I go. So you can try that. You're not going to feel as much until you get to almost like the halfway point in the calf. When it starts going from being more tendon-like to more muscle-like, in that transition point is usually where there's a knot or that tightness. and we all tend to have some very tight calves. So doing the calves can help out the knees. It can also help out if you have plantar fasciitis or maybe even shin splints. So a lot of times the calf is becoming over dominant and it's hurting the other things that are around it. So if you can actually get the calf to relax, some of these other areas, the plantar fascia, the shin, or the knee can have an easier time because the calf's not being a bully as much anymore. So you're going to roll down and you're going to try to get to, again, just before the knee, and you'll be good to go there. You know, I'm going to leave it at those two because those are the two critical ones. There's a few other ones that you can do as well. But if you get started, try those two. If you need more than that, I can send you another video with more foam rolling exercise that you can do. So this is Jeremy Biernight saying, have fun and be safe.